Diphtheria is a serious bacterial infection that primarily affects the mucous membranes of the throat and nose. It is caused by the bacterium Corynebacterium diphtheriae, which produces a potent toxin that can lead to severe complications, including difficulty breathing, heart failure, and even death if untreated. Diphtheria was once a leading cause of death in children, but the development of vaccines has made it largely preventable and rare in many parts of the world. Transmission and incubation period. Diphtheria is primarily spread through respiratory droplets when an infected person coughs or sneezes. It can also be contracted by direct contact with an infected person or contaminated surfaces. The bacteria can live in the throat or on the skin of an infected person without causing any symptoms, which can result in the unknowing spread of the disease. The incubation period, the time between exposure to the bacteria and the onset of symptoms, typically ranges from 2 to 5 days. During this time, the bacteria begin to multiply in the respiratory system, producing toxins that cause inflammation and damage to the surrounding tissues. Symptoms of diphtheria. The symptoms of diphtheria begin suddenly and often include sore throat. One of the first symptoms is a severe sore throat, which may make swallowing painful. Fever. A mild to moderate fever often accompanies the sore throat. Weakness. As the infection progresses, individuals may feel increasingly weak or fatigued. Swollen lymph nodes. The lymph nodes in the neck may become enlarged and tender. Pseudomembrane formation. One of the hallmark signs of diphtheria is the development of a thick, grayish-white membrane, known as a pseudomembrane, on the throat and tonsils. This membrane is made of dead tissue, bacteria, and inflammatory cells. It can obstruct the airway, making breathing difficult and potentially leading to suffocation. Complications of diphtheria. If left untreated, diphtheria can lead to severe complications, which may include airway obstruction. The pseudomembrane can grow large enough to block the airway, leading to difficulty breathing or even suffocation. Toxin-related damage. The diphtheria toxin can spread throughout the body, leading to damage to various organs, especially the heart and nerves. Cardiac complications. The toxin can cause inflammation of the heart muscle, known as myocarditis, which can lead to heart failure, arrhythmias, or sudden death. Neurological complications. The toxin can also damage the nerves, causing paralysis, particularly in the soft palate, which can affect swallowing and breathing. Kidney failure. In some cases, diphtheria can lead to kidney damage, contributing to kidney failure. Death. In severe cases, without prompt medical treatment, diphtheria can result in death due to complications such as airway obstruction, heart failure, or sepsis. Diagnosis. The diagnosis of diphtheria is typically made through a combination of clinical symptoms and laboratory testing. A doctor will examine the patient for characteristic symptoms, particularly the pseudomembrane in the throat, and may take a throat swab to test for the presence of Corynebacterium diphtheriae. In some cases, blood tests may also be conducted to detect toxins produced by the bacteria. Treatment. Diphtheria requires urgent medical treatment. The primary treatment for diphtheria includes diphtheria antitoxin. This is a medication that neutralizes the diphtheria toxin and is critical in preventing further damage to the body. It is administered intravenously or by injection. Antibiotics. Antibiotics such as penicillin or erythromycin are used to kill the bacteria and stop the spread of infection. These medications help to clear the bacteria from the body and prevent transmission to others. Supportive care. In severe cases, patients may require additional treatments, such as mechanical ventilation to help with breathing if the airway becomes blocked or weakened. Prevention. The best way to prevent diphtheria is through vaccination. The diphtheria vaccine, which is part of the routine childhood vaccination schedule, is safe and effective. The vaccine is usually given as part of the combination DTaP vaccine, which also protects against tetanus and pertussis, whooping cough. Booster doses of the diphtheria vaccine are recommended for adults, especially for those who travel to areas where diphtheria is still prevalent. Immunization has drastically reduced the incidence of diphtheria worldwide. Conclusion: diphtheria is a potentially life-threatening disease that has been largely controlled in many parts of the world through widespread vaccination. However, it remains a serious concern in areas where vaccination rates are low or where the disease is endemic. Early diagnosis and prompt treatment with antitoxin and antibiotics are essential for reducing the risk of severe complications and death. The continued use of vaccines remains the cornerstone of global efforts to eliminate diphtheria.